What is up, sapiosexuals? Welcome to Sex Solutions with Dr. Sonjia. So, the sex problem that we're going to solve today is female sexual dysfunction. And this is a huge problem, considered by some experts to be the greatest health problem that is the most widespread in the world after substance abuse. That is huge, people. Nearly 50% of women experience sexual dysfunction in their lifetime, and that is insane. But that all changes today because as more women rise to healthcare leadership positions, more attention is finally being paid to the healthcare needs to improve female sexual functioning. That's why today I am absolutely ecstatic to have Dr. Jean Johnson with us from Rejuvenation For Her, which is a treatment center in South Florida that treats women's sexual functioning from a holistic perspective. She's the physician and creative director, and she is an expert provider of vaginal laser rejuvenation, and she does the O shot. You heard me, the orgasm shot. And she's also a breast cancer survivor. So she knows a lot professionally and personally about how important it is to have a wealth of services focused on improving female sexual functioning. I am so excited. Thank you so much for being here, Dr. Johnson.
You exude excitement, so it makes me excited to be here. My initial role as a physician had nothing to do with sexual health and women. I actually took care of patients as an anesthesiologist. That's where my mission started with medicine.
Relieving
university.
pain.
Right, yes. Until 2014, things changed. My life changed when I was diagnosed with breast cancer. Unfortunately, my treatment required that I have a bilateral mastectomy.
So that was the inspiration for your practice.
Exactly.
You're not done. You still have life to live. You still have pleasure to feel.
Yeah. And that's exactly what I said. I said, well, something is not right about what happened to me. Maybe I feel like I made a good decision for how I was going to treat me breast cancer wise. I was still here and I'm functioning, but that organ was not functioning.
What are some of the common symptoms, sexual symptoms, that women, cancer survivors, experience? And I think they're very similar to the symptoms that women going through menopause often experience. Is that correct?
Yes, and I think it pretty much, as I think about it even more, it's a mental as well as a physical change. Mentally, you feel different. If you have your breast removed or a part of your breast or, one breast, some people do a single, but, and not bilateral. But you feel like mentally as a woman that you've lost something. When you go through menopause,
Right.
A lot of that same thing happens. But it's a mental and it's a physical for both.
Because with menopause, you're losing the ability to continue giving birth. You're losing your childbearing capability.
Absolutely.
And a lot of women associate their feminine power with their ability to bear children.
Absolutely. In addition to what you're saying, you lose vital hormones when you go through menopause. When you go through breast cancer treatment, it just happens like overnight.
Wow.
And so the symptoms are even more severe, like the vaginal dryness that you get with menopause, a slow progression.
Right.
It happens like 10 times more with radiation and chemotherapy.
Wow. So there's vaginal dryness,
painful intercourse.
Painful intercourse.
You lose a lot of your self-worth. You don't want to have pain when you're having intercourse. I mean, you're not going to be interested. So what you tend to do is you have intercourse less.
Right.
Well, that promotes vaginal atrophy.
Right.
Because you're not using it.
If you don't use it, you're going to lose it.
That's it. There are solutions there that can help us.
Absolutely. And we're going to talk about those solutions when we come right back. We'll be right back with Sex Solutions.
My Uber driver lost his mind the other day, but he blamed me. He said I smelled so good he became too excited to drive. This man actually pulled over to get himself together. And he refused to drive until I told him the name of my fragrance. Then he bought 3 bottles before driving again. I know Sense body oil makes men crazy, but that Uber ride should be free.
Get yours at Amazon or sensebodyoil.com. Welcome back to Sex Solutions with Dr. Sonjia. We're here with Dr. Jean Johnson, and she is the physician and creative director at Rejuvenation For Her, and she treats female sexual dysfunction every day. So let's talk about the O shot. But the reason why the O shot is so interesting to me is because it's a non-hormonal right, procedure that can be done like at lunchtime for women who are cancer survivors or for women who want to stay away from hormones for other reasons. I think it's a viable solution, and I want more people to be aware of this.
So yes, the O shot. But they found that this actually helps women who have sexual dysfunction, orgasms, also dryness, and also pelvic floor urinary incontinence. It's holistic. We take your blood and we spin it down. And some of you probably have heard of it before because it's also for the face. We use it also.
I have told people in the past that the O shot is the vampire facial.
Yes.
It's the same thing. So if you ever saw Kim Kardashian getting the vampire facial, then you've seen what the O shot is, except for it's on a different part of your body.
Because a lot of the area also loses collagen and elastin, just like our faces do. It ages.
Wow.
It ages like everything else. So we go south here in the face, but we go south there too.
My body can produce my own medicine to improve my sexual functioning. That's empowerment.
A lot of what we do to the skin here, the vaginal area is also skin.
So basically, when we're going for our facials and all that, we should also be going for our facials down south and getting all of those restorative procedures done simultaneously on both.
Right. But we inject the serum into the clitoris and then into the anterior vaginal wall. So that all of the leukotrienes, all of the good things that are in that serum, we call it the gold. It has all of those nutrients that we're trying to maintain or that we have lost to replace. And it really does help urinary incontinence, like I said.
I know over 70% of women will experience urinary incontinence at some point in their life.
I call everything in my office prejuvenation. So you try not to allow it to happen. It's, you have to notice something is changing because you're still losing collagen and elastin every year. So like I said, everything is going to go south. You want to catch it when you first start getting the sneezing and the cough, the urinary leakage with sneezing and coughing. It's going to happen. It's going to happen. You just got to get it early. And there are treatments for that too. I have that also.
So the O shot will really help with urinary incontinence and also has the potential to improve sexual fulfillment.
Yes.
And
lubrication.
Your practice.
Yes.
You can get both done. Is that you can get your face done and you can get your sweet spot down south done as well?
Absolutely.
And I know you also do laser vaginal rejuvenation, and we're going to talk about that right after the break. Yes. I cannot wait. Stay tuned to Sex Solutions with Dr. Sonjia, and when we come back, we're going to learn all about vaginal laser rejuvenation.
I just had the craziest experience at the Apple store. I needed my phone fixed and didn't have an appointment. The store was packed, but as soon as I walked in, all the Apple guys swarmed around me like I was the newest iPhone. It was weird. Instead of making me wait in line, the tall manager guy came over and helped me right away. And when he saw my screen was cracked, he simply asked someone to get a replacement for free. No questions asked. Then he asked me what fragrance I was wearing. When I looked at him like a freak, he told me all the guys went nuts when I walked in because I smelled so good. And that's when it hit me. I was wearing Sense aromatherapy body oil. It smells amazing. and also stimulates a pleasing reaction in everyone who smells me. Ladies, take it from me. Never go to the Apple Store without your scents. Smell good, feel good, Scents Body Oil.
Get yours at Amazon or sensebodyoil.com. Welcome back to Sex Solutions. I'm so interested in hearing about vaginal laser rejuvenation. Tell us what it is and what it does and how we're going to feel after we get it done.
Okay. So the laser vaginal rejuvenation is a non-hormonal procedure. There's no cutting. So there's no downtime from having a surgery. It's not a surgery. It's all non-invasive and holistic. Just like we use the laser into the face, we can use the laser in the vaginal area because it's also skin. Basically, when you treat the vaginal area with a laser, it rejuvenates the vaginal area. It's heat, and that heat actually helps your body to restore normal vaginal tissue. So like it was back in the day. So it'll take you back some years. When you develop the normal tissue, then it works like it did before. So it's like I said, no downtime. The only downtime is intercourse. So you can't have intercourse right away after you have the treatment because you have to allow for some healing. The healing from the laser, which causes the tissues to become more plump, to produce more lubrication. It tightens because it produces collagen and elastin.
Wow.
So it makes it tighter. And the feeling, because that stimulation of the laser produces more feeling because you develop more nerves, you develop more blood flow, all those things that you lose when you stop having intercourse.
Right.
So pain is a major one because what happens if you don't take care of the dryness and the atrophy, then you start having pain with intercourse, and then it's just a vicious cycle. So you don't want to have it more, so you do it less.
A lot of women go through stretches of time where they may not have intercourse for a year or 2 years or even more sometimes. And a lot of women are under the assumption, oh, when I have intercourse again, I'll be so tight. It'll feel like I'm a virgin again. But that's not really what happens, is it?
Not after you go through menopause. When you go through menopause, when you don't come together, it gets worse. And it does not stretch anymore. So you lose elastin, you lose collagen, which allows it to stretch to be able to tolerate anything there. So if it doesn't stretch, it is very, very uncomfortable. And that's where the pain comes in. Now, when that starts happening, it's harder to treat. So ideally, that's why I say the prejuvenation comes into effect.
Prejuvenation.
I call it prejuvenation, right.
Before you need rejuvenation.
So when you start like 48, 49, and you're going through, you're going to feel, so most people come to me at that age and say, well, it feels really different from when I'm with someone, or I want to be with someone. I just want to make sure that I'm okay, and mentally I'm okay, and I feel the confidence to be with that person. And then that's when they'll come and they'll do the treatment before they become intimate with someone. I have people who haven't had intercourse for like years, and I can bring them back.
Wow. So is this a one-time treatment?
No, it's not. So you do the treatment. It's a series of 3 to 4.
Okay.
Depending on, everybody's different. Like some people come to me, they haven't had intercourse in 3 years. Some people still having intercourse, or like they've started to like decrease because it is painful. So we can catch it before it gets to pain, then we can do less, in other words, is what I'm saying. Because when the pain starts, mentally your mind is already thinking that you're going to have pain. You know what I mean? When you have
the bottom line is, as soon as you start feeling differences
yes,
that are not good, go see Dr. Jean.
Yes. If you say it doesn't feel the same, or I don't feel anything, that's often what people say. And
often, I know as women are aging, it's not a dramatic change. Sometimes it can be a subtle change. I like the term incomplete orgasm. It's not quite as powerful of an orgasm as you used to have, or the sensations aren't as strong as you used to have, which is why I really like your approach of thinking about how we can sort of heighten the sensations, because those nerve endings, that's what dazzles us.
Absolutely.
Becoming aroused, desire, it's our nerve endings turning on. So this treatment really focuses on really
producing all of that, bringing all of it back.
Right. So a little boom, adding a little spark.
Yeah.
And that's, don't we all deserve a little spark?
Yes, absolutely. Listen, relationships are about pleasing and fulfillment on both ends.
Absolutely. And don't you ever forget that, ladies.
Okay,
ends. Reciprocity.
That's right. On both ends, not just for him, for her too.
Absolutely. We are here. We're going to squash that OGAB.
Yeah.
One question. Do men ever come with their partners with you?
Absolutely. Absolutely. I actually encourage that because they want to know what's happening, because you go through the internet and you find different things on the internet that may not be true. They have questions, and sometimes, they're the ones who want to pay for it.
Awesome.
So I encourage that. It's a couple's treatment.
Awesome.
So I love it. And I tell them, you want your husband to come in? Some will say, no, I don't. Or some just come privately and say, I don't really want him to know I'm doing it. But they come together. I'm more than happy to talk to couples, because especially my couples who it's painful intercourse, because they're getting together, but they're not having intercourse.
Right.
So they have to start all over, and I have to coach them. And sometimes I have to coach the men. You got to take this slow. You got to do it like this first, and then you got to try that. It's a coaching.
Best doctor ever. Therapist, doctor. She'll talk to your man. She'll talk to you.
That's it. I'll talk to anybody. I'll tell you, because I know it from my own experience. I can tell you, well, you got to try this way, and you got to wait, because, we get detailed.
Right.
You know what I mean?
Right.
So you got, it's not going to happen overnight, because collagen and elastin still takes 6 weeks. So you'll be able to notice a difference each time you do it. And they'll be glad to hear that you got to do it more.
Okay.
And they'll be like, oh, we got to do it more. Yeah, you're not doing
That's
enough.
your homework.
Once a week is not enough, because I got to get those juices flowing, and I got to get nerve, and something has to go there in order for that to happen, especially after I do the laser.
I'm so happy I'm not the only one giving sex for homework.
So you got to do it more. That's how you keep it going.
All right, guys, it's time for our climax, when we give you a couple of points to remember about solutions for female sexual dysfunction with Dr. Jean from Rejuvenation For Her. 1, there are so many holistic treatment options out there. I know you have machines there that are non-hormonal that help women strengthen their pelvic floor.
Yes.
And then I love the O-Shot. There are so few female providers who do the O-Shot. And I know if I get the O-Shot, I want to get it from a woman, and a woman who's cool like you. And guess what? She's going to give me a vampire facial at the same time. And 2, laser vaginal rejuvenation. I know a lot of women think that after cancer that they can't have certain processes or procedures done to restore sexual functioning. So how empowering is it that we have a physician who not only performs this, but who is also a survivor? So she has the professional and the personal expertise to be really definitely the right person for anyone who asks me where to go when they've experienced breast or ovarian cancer.
Yes, I honestly believe that this treatment was a gift from God. I really do. I don't want to get religious about it, but my personal feeling, I said a prayer because I had my husband. I wasn't done, and I needed a solution, and I found it. And when I found it, I felt like I needed to spread it.
Wow.
So that's my calling.
Doing God's work, girl.
Doing God's work. Keeping relationships together, keeping marriages together. I'm telling you.
Yes,
really,
Isaac, stronger couples, build stronger communities, right? And that is absolutely what we need.
Yes, so it's a gift.
How do they find you? Tell us where to find you.
rejuvenationforher.com is my website, and Rejuvenation For Her on Instagram and Facebook under Rejuvenation For Her. My phone number, I speak to all of my, so it's a little bit unique.
Wow.
954-445-6077. You're going to talk to me. I do not like answering services. When I do your treatment, I want you to be able to talk to me. Because I want you to give me the feedback so that I can ease all of your nerves and that you don't have to worry. I can tell you, and I don't wait for answering service to call me to call you. You have my number.
Amazing.
Personal. So it's a little bit unique because you can't talk to a doctor.
Everything about you and your practice is completely unique. Thank you so much for tuning into Sex Solutions and for being here.
Thank you so much.
Thank you. It has been wonderful.
It's been a pleasure spreading this.
One orgasm at a time. I had so much fun talking to Dr. Jean and you guys today about solutions for female sexual dysfunction, and I cannot wait to do it again next time. For your daily dose of Nookie knowledge, check me out on all your socials. Dr. Sonjia, DrSonjia, LinkedIn, TikTok, Instagram. Come on, I know you want to link up. We'll see you next time at Sex Solutions, where everyone comes for happier, healthier sex.